Hello and welcome to my presentation on the Sociology of Health by Amy Bennett. To start this presentation, we're going to talk about what health is. As defined by the World Health Organization in 1946, health is a state of complete physical, mental and social well-being, and not merely the absence of disease and infirmity. This is a controversial definition due to ongoing debate, as continual adjustments to meet global demands create uncertainty to whether this definition still holds truth. There are many aspects that impact a person's health or ill health, and the widely recognised social determinants of health refer to the economic, environmental, social and political factors that influence a person's physical and mental well-being. To start the conversation on the sociology present in today's society, we're going to talk about the start of modern medicine in the 18th century, known as the Enlightenment period, when religious theories succumbed to scientific explanation and secular theory, medicine became increasingly professionalised and popularised. In this embrace of the new medical systems derived alternative, individualised views to the social determinants of sickness and health. This critical period in the history of medicine introduced medical policing, and the biology of the bodies became suspect to large-scale political intervention. Throughout this presentation, we're going to discuss differing sociological perspectives, concepts and models, the social construction of health, and complementary and alternative medicines. The first social theory that I'm going to discuss is Marxism, also known as conflict theory. Marxists believe that human society is based on material forces and that the bourgeoisie are superior to the proletariat. They believe that social inequalities influence the distribution of healthcare, and they state that people from lower classes and disadvantaged backgrounds are more likely to become ill, whilst also more likely to be let down by healthcare services. The social class structure is mirrored in the healthcare systems through control over health workers, health institutions and stratification. They also recognise the turn in modern day society, of which capitalism has reconstructed and reconfigured the healthcare institutions into a market commodity, and medical centres have evolved into medical industrial complexes. Those with financial capability will be able to afford it, and as previous social problems are now being categorised as medical problems, this has become a burden to the lower classes. Following on with functionalist theory, good health and effective healthcare are essential in the stability of society and equilibrium. Illness is seen as deviance, as it inhibits the behaviour to fulfil the socially appropriate role. In the 1950s, Talcott Parsons defined this role as the sick role, and under this role, the afflicted was afforded rights and obligations as described in his 4 postulates. Number 1, the sick should not have contributed to or caused their own ill health. Number 2, they must want to get well again. Number 3, they are exempt from carrying out their normal day-to-day roles, such as work. And number 4, they have been professionally diagnosed and submit to medical care in order to get better. Today, there is an increasing number of chronically sick people, and being sick is no longer a temporary phase. With concerns of avoiding the sick role altogether, illness does not exempt us from our normal day routines. The medical profession has accordingly submitted to the demise of the sick role, offering choice to patients, so the burden of disease does no longer become the burden of treatment. In feminist theory, they believe that medicine and patriarchy enforce passivity, dependence and submission to control women. As stated by Seaman in 1987, multinational drug companies reinforce patriarchy, sexist attitudes, medical authority and patient powerlessness. Women's illnesses are both a consequence and a response, as medicine has labelled women's resistance to their expected roles with a set of specific illnesses. such as anorexia nervosa and hysteria. Women are medically and socially constructed as the sick and inferior gender. Paradoxically, they live longer. Other examples of social perspectives are postmodernism, who describe the changes faced by the medical profession in correlation to economic development, and interactionist theory, who regard health and ill health as social constructs, which will be discussed throughout this presentation. Concepts and models are prevalent throughout the sociology of health. A concept is an idea perceived in the mind, and they provide different views towards health. There is the negative concept of health, positive concept of health, and the holistic concept of health. The negative concept is a deficit model where the individual believes that when they are feeling healthy, they are not suffering from any ill health. As said by many, not visiting the doctor for years is an indicator of good health, and this is especially prevalent in the older generations. This concept means that they take very few steps to improve their well-being, and although this does not provide the full picture. Health can also be defined in an individual's recovery time, and whilst they may feel better quickly, this does not guarantee health, and this view is very, very rarely found in health professionals. Whilst the negative concept focuses on what health isn't, the positive concept focuses on what health is. In this model, the individual will make conscious and continual efforts to improve their well-being and live a healthy lifestyle through activities such as exercise, stress management, healthy eating. The individual is taking an active interest in achieving both physical and mental health. As seen in research by Seligman, scientists and researchers are trying to identify the correlation between health assets and positive health outcomes. In the modern day society, an individual is expected to take responsibility for their own health and use preventative measures to improve it. It is key that a successful use of preventative healthcare campaigns and health-conscious individuals with a positive concept mindset will cost the healthcare system less money. The holistic concept covers a more in-depth view of health. This model factors the mind and body as a whole and believes there is a strong link between our physical, intellectual, emotional and social health. Looking at the patients as a whole individual can improve the effectiveness of healthcare professionals, which is reflected in the number of individuals utilising this view. However, this may cause a blurring of boundaries in the doctor-patient relationship and a loss of focus on who and what is responsible for the ill health. Further disparity away from the medical biological concept of illness is the conceptual framework of social constructionism. This is the social perspective that argues the social dimensions of health and how society creates conceptions of health and ill health resulting from social interaction and dynamics. Social interpretation of illness creates perception that differs from the traditional approach, and using sociological imagination can create an entirely new perspective, as said by Elliot Friedson. Human behaviour changes by diagnosis, as a social state is added to a biophysiological state with the assignment of illness to disease. Social construction is a major area of research as relayed by Conrad and Baker in their 2010 research. They identified the cultural construct of illness, the social construct, and the social construct of medical knowledge. The construction of medical knowledge ties knowledge into power, as explained by social theorist Michael Foucault. This has created a power relationship between the doctors and the patients known as the clinical gaze. This can lead to bias on part of the medical professional. Social constructivism surrounding cultural backgrounds and social interaction has created stigmatisation and ignorance surrounding particular illnesses. This can impact how or if an individual will inform others of their illness. Secrecy resulting from social construction can have the potential to hinder their capability of managing their illness. Individuals may become defined by their illness, whilst others might utilise their illness for self-discovery and change, as seen in the Paralympians. There are further explanations into the impact of social inequalities on healthcare and the impact on the population. Explanations found in the 1982 Black Report evaluating the NHS were not dissimilar to those found in the Patient Plus article by British doctors. It is believed in the artefact explanation that the relationship between social classes and health inequalities is artificial due to biased information. Both have constructed a cultural explanation believing that socio-economic factors influence an individual's health, both directly and indirectly. It may suggest that it is the lower classes that opt for an unhealthy lifestyle, which is not backed up by data, as patterns of ill health are widespread across all classes. Whether a high or low class member of society, social cohesion is beneficial to an individual's health, with relevance to today's current situation. Social isolation is found to have had an adverse effect on health, which deepens the need for social cohesion and community. Additionally, there are recent explanations of health inequalities. The neo-materialist explanation explains how inequalities have resulted from experiences and exposures to the materialist world, and the psychosocial approach explains the connection between health and the likes of income inequality and social anxiety. There is a new societal narrative that has been introduced to the traditional medicine in recent years. There is an increasing use of complementary and alternative medicines. Complementary medicines are used alongside traditional approaches, and alternative medicines are used instead. The recognition of professionals of the link between the mind and the body is shown in the integrated medicine wheel. Professionals are realising that greater patient responses are received from understanding connection in the doctor-patient relationships rather than solely the use of medical knowledge. People use CAM to take an active role in their recovery and treatment. The additional choice may offer hope and improve their quality of life. Examples may be mindfulness, acupuncture, and osteopathy. The immune response may improve with doctor empathy, and the use of time and touch offered by the CAM therapist can have a positive effect on the patient's oxytocin levels and self-esteem. However, some methods are less socially acceptable and require further research. There remains a level of scepticism, and some may not feel comfortable using them. With more than half the population using some form of CAM therapy, and the numbers still on the rise, it is evident that there is a level of success in the methods used. The therapeutic effect has been found to help the terminally ill reduce or cure persisting pain. It is important to highlight the possible dangers, as not all methods require a certified level of training that the traditional medical professionals do, and there is still a possibility of undesired side effects. The traditional view sees their approach as the adhered medical norm and believe they hold power in medical hierarchy. However, as society is becoming ever more individualised and patients are now taking a role as consumer, attitudes are changing and many are choosing the path of choice. Finally, to conclude, the developments in the understanding and practices in health are parallel to the developing technological society. As society becomes ever more individualised, the increasing choice of treatment allows patients to have control over their recovery and the preventative measures used to control it. A reference list and bibliography will be included in the notes used for this presentation. Thank you for watching.